Hello and welcome to our community assessment of Midland County. This presentation will inform you of the unique benefits and challenges of living in Midland County, as well as identify specific public health risks and ways to mitigate those risks and promote community wellness. This information was collected and presented by Paige Hanna, Caitlin Harper, John Cotton, Laura Simpkins, Zach Phillips, Rachel Hellebuck, Rebecca Harper, and Jenny Pareto. Midland County is a 516 square mile community in central Michigan. There are 162 people per square mile and nearly 37,000 housing units. Midland has some unique geographical features such as 3 forests and woods, 18 lakes, 37 streams, and 4 oil fields. There are many schools in Midland County to promote education and churches that provide services for a wide variety of vulnerable populations. There are many ways for residents to have recreation and maintain fitness, with 77 parks and over 50 miles of trails for hiking, walking, and biking. Midland County also has adequate health coverage for the number of residents, with over 90 family physicians. Midland County has over 83,000 residents, with 50.7% being female and 21.5% under the age of 18. Midland County residents are predominantly white with a high school diploma. 60.9% of residents are employed, and 8.9% of residents under 65 are disabled. The median household income is around $55,000 annually, with under 10% of residents living in poverty.
There are several risk factors that impact Midland uniquely: a high incidence of chlamydia infection, high hospitalization rates for opioids, lower than average rates of child vaccinations, above average rates of adult obesity, and environmental risks from chemical exposure, including dioxin in the soil. To address these risk factors, many preventative programs have been put in place to promote the health and wellness of the community. These include the Take Cover program initiated by the Midland County Health Department to distribute free condoms, STI information, and contraceptive information to the community. A free and low-cost vaccination clinic at the health department is available, as well as screening clinics for breast health, reproductive health for both men and women, and vision and hearing. There are community gardens and fitness programs that promote public wellness, sponsored by various agencies, and scholarships are available for those in need. On the following slides, we will discuss specific resources available to residents of Midland County that address the public health concepts of reproduction, vulnerability, growth and development, violence, disaster, diversity, and health promotion, and the relationships between these concepts. One of the most valuable resources Midland has to offer is its very own health department. The numerous programs, services, and clinics readily available address many of the public health concerns of the community and aid in promoting the health of Midland County's residents. We interviewed Mary, the Clinical Services Director at the Midland County Health Department, and asked her to give us a brief overview of the resources offered to the community and what sets Midland's Health Department apart from the rest.
Clinic side, we have a family planning clinic, we have an international travel clinic, we have an immunization clinic, we have an STD clinic, and that's paired with the communicable disease clinic. Provide STD testing and then treatment if we come back for positives. In family planning, we provide annual exams, so a basic physical exam, and then any kind of birth control that anybody might want. International travel, we're one of the few travel clinics in this area. I think there's only 6 in the state right now that can provide people with yellow fever. Then the community health nurses participate in the maternal infant health program, so they go out and do home visits with moms who are expecting, and then also moms and babies after they deliver. And we have the Children's Special Health Care program, so kids with disabilities up to, I think, 19 or 21, actually. I think they've changed the age limit. But something, if they're chronic diseases and things that they might need extra medical care for, people can sign up for that. We have an emergency preparedness coordinator, so she has to do with disasters, and she works often with the emergency services, which we also house in this building. We do provide rapid HIV testing, which not all health departments do. We provide a lot more birth control than a lot of places do. We have a lot more on site. We are also able to script it out, but if somebody has insurance and they can go pick it up at their local drugstore, we're able to e-script it. Not everybody's on an electronic health record, and we have been for a long time, and ours is pretty fast, so we really like it. We're kind of small, but we do a lot.
Mary's interview highlighted the services at the Midland Health Department available to address any of their vulnerable populations, their reproductive needs of the county, the growth and development of its different generations, and disaster preparedness.
WIC is an important resource in Midland County. They support mothers and their children under the age of 5. They also do breastfeeding education and support. They do safe sleep, education, car seat safety, nutrition programs, free diaper distribution, and education on early Head Start, which is just a resource to get children 0 to 3 in education programs. They all relate to the concepts of growth and development, reproduction, vulnerability, and health promotion.
Safe and Sound is a resource that has child abuse prevention programs and investigation services. It is related to the following concepts: violence, vulnerability, and growth and development. They also have parenting resources that include safe sleep, car seat safety, post-neglect and abuse counseling, and pediatric oral health. The Arc of Midland is a facility that advocates for people with intellectual disabilities, Down syndrome, and autism. They promote general welfare by increasing participation in the community, developing employment skills, planning for education, and managing money. The Arc of Midland relates to concepts: vulnerability due to the population decreased access to resources, health promotion to make sure they have access to all community resources, and diversity.
For victims of violence or those vulnerable individuals in need of shelter, food, or clothing, the Open Door and Shelter House provide assistance as well as counseling services and other programs to promote the health of the community. The Shelter House offers safety and counseling for women and children who are victims of violence. The Open Door provides safety, shelter, clothing, and a daily soup kitchen, as well as monthly blood pressure screenings.
Midland County is vulnerable to many types of disasters. Living in Michigan, we all know the potential threat we face in regards to weather. However, a failure of infrastructure could also snowball into a disaster. Midland County is home to several bridges, trainways, and petroleum or natural gas pipelines. Public health emergencies could result from disease epidemics, food or water contamination, or exposure to hazardous chemicals. With Dow Chemical located in Midland, there is a risk associated with hazardous material release and an increased threat of terrorism. On the next slide, we will see how some of the threats to Midland County are ranked. This is Midland County's hazard ranking taken from the Midland Hazard Mitigation Plan of 2013. The mitigation plan is scheduled to be updated every 5 years by Midland County's Emergency Management Office and is currently under review. As you can see by the hazard rankings, severe winds, winter weather, and river flooding are the top 3 hazards to Midland County. This is Midland County's 2013 Hazard and Vulnerability Assessment Rating Table. This table rates hazards that Midland County may be vulnerable to against multiple categories. Categories are ranked on a scale of 1 to 10, with 10 posing the greatest risk. For example, looking at this table, you can see that severe winds and river flooding are our highest ranked on the likelihood of occurrence, however, are not the highest ranked in regards to percentage of population affected. Public health emergencies shows that the likelihood of occurrence is low, however, if it does occur, the percentage of population affected is high.
In diagnosing the needs of the Midland County community, we determined factors where the level of risk was higher than average and additional programs were needed to address the problem. For our first diagnosis, we determined that there is a risk of injury among residents of Midland County related to elevated rates of drug-related hospitalizations, elevated rates of alcohol-related hospitalizations, and increased incidence of opioid usage. Interventions for this issue include substance abuse, addiction treatment, and mental health counseling services, DARE and other drug prevention programs, and the introduction of a Narcan distribution program. Our recommendations include implementing brief alcohol screening and intervention program for college students, implementing drug abuse prevention programs with school-based components such as DARE or MAD, family or parenting programs, mass media campaigns, and public policy initiatives, and other types of community organization and activities, and also to evaluate youth for co-occurring psychiatric disorders that could heighten their risk for substance abuse in the future.
Community diagnosis number 2. Risk of infection among sexually active individuals in Midland County related to increased incidence of gonorrhea, chlamydia, and other STIs. Community interventions and recommendations. Interventions. Provide safe sex education in schools, Midland County Health Department's reproductive services, and Take Cover program. Recommendations: getting tested after unprotected sex, limiting sexual partners, knowing where to seek help for education, and educating teenagers and young adults about safe sex practices.
For our last diagnosis, we considered the increased level of risk of disaster related to Midland's severe winter conditions, high winds, and especially due to the presence of over 50 bodies of water, the large percentage of homes and properties in the floodplain, and recent severe flooding that resulted in declaration of a state emergency. We concluded that there is a risk for disaster among residents in Midland County related to severe winds, winter weather, and flooding. Interventions for our third diagnosis include disaster coordination services at Mid-Michigan Health, offering temporary emergency shelter, and implement building inspections to ensure they meet current disaster code recommendations. Our recommendations include increased training and simulation to improve disaster readiness, increase awareness of shelter locations in Midland, and create a disaster recovery plan that encompasses physical, emotional, and environmental community health.
Thank you for watching our presentation on Midland County. Here are a couple references that we had throughout the presentation. Do you have any questions?